OBHC. For today's presentation titled Dismantling, Decolonizing, and Deconstructing to Achieve Equity, Diversity, and Inclusion by Dr. Estela Vasquez-Guzman, JD, PhD, one of our very own here at OHSU in our Department of Family Medicine. And before I say anything else, remember everyone, please mute yourself. This talk will be recorded, and Dave will begin recording. So this is the Oregon Bioethics and Humanities Colloquium. It's a lecture series where we hopefully create a space for thought-provoking discussion and exploration into complex bioethical issues that revolve around philosophy, humanities, health policy, and other forms of cutting-edge research. Here at OBHC, we aim to create an environment where we foster critical examination of the human experience, and we seek to provide new and innovative perspectives that will challenge all who attend. And I anticipate we will indeed be challenged today, because it's my pleasure to introduce our speaker, Dr. Estela Vasquez-Guzman. Dr. Vasquez-Guzman trained at the University of New Mexico, where she specialized in medical sociology, race, and ethnicity. Her involvement with the Robert Wood Johnson Foundation Center for Health Policy, Satra Health Leadership Institute, and State Priorities Partnership has provided an interdisciplinary training influential to her multi-dimensional understanding of racial, ethnic health, and healthcare disparities. Dr. Vasquez-Guzman has specific interest in social, cultural, structural, humanistic curriculum for medical students and residents, as well as investigating inequities in medicine, health, and health delivery among Native American and Latinx communities. Currently, through 2 grants, she is analyzing the structural factors impacting cervical cancer and documenting Latina women's unique lived experiences with the Health Experiences Research Network at OHSU. Dr. Vasquez-Guzman and colleagues are also investigating cervical cancer screening disparities among older Latina migrant farm workers and non-Hispanic whites using data from OCHIN, a national network of community health centers. Just a personal remark, we seldomly know the impact of our words. They just float out there in the world, doing as they may. And I think I've told Dr. Vasquez-Guzman this, but several years ago, the first time we ever spoke, she kind of offhandedly noted that she felt one of the most sort of urgent and important ethical questions today is the question of where our tax money go. And she spent some time researching that. And I've thought about that ever since. And just the way that something that seems so ordinary and not necessarily a moral question or concern is actually critical to the health and flourishing of all of us. And so I'm just really excited and grateful that she'll spend the next hour talking to us about her work. After she's finished talking, we'll have some Q&A. Please put your questions and answers in the chat as we go along, and I'll do my best to moderate it. You can either speak up or raise your hand, and feel free to turn your camera off for the duration of the talk. And then I'd really ask if you are willing to turn your camera on for Q&A. And with that, I will turn it over to you. Thank you.
Gracias. I am so honored to be here, and I can already feel a big sense of community in this space. Like, I love the shout outs and all the welcoming invites of everyone here. So I feel like it's a unique place you guys have. So let me just start with sharing my screen. All right. Well, so today I have a pretty big topic, and of course, in 45, 50 minutes, we can do as much as we can, but my goal today is really just to plant some seeds, and it's an honor that the tax conversation we had was one of those seeds for you. I'm going to be talking about dismantling, decolonizing, and deconstructing, what I call the 3 Ds, to really achieve equity, diversity, and inclusion. And while we have significant efforts already being made about shifting our culture, like a lot of movement is about culture and what we say and how we say things, I'm really much interested in how we shift our harmful systems that remain in place and that sometimes seem too big for us to address. And so for me, because of my background in sociology, I really do care about how do we look at large systems. I have a background in community-based participatory research, so it's not just about looking at a systemic level from this theoretical perspective, But for me, it's like, how do we look at it from a community perspective, right? Which is why I love this community that I feel in this space, because for me, it's all about relationships and communities and how do we really elevate not just our research, but our teaching and our clinical care. I know we have people joining this call who do a wide range, or if not all of those three things. And so I hope there's something relevant in my talk for each of those little buckets. But to get started, no financial disclosures. Not yet. I wish I had some, but nope. But I always think it's important for me to start with my positionality. So who am I and why do I do the work that I do? Oregon is actually my home, but I'm a 1.5 immigrant, which means I was born in Mexico, but I grew up in the United States. So I'm one of those weird middle people that neither home feels like home, but I would say Oregon is my home. And then I would say New Mexico is my second home because I left for about 15 years to do all this training. And like Dr. Tate just mentioned, I left to do policy training for years in taxes, education, healthcare, immigration, and it really just changed the way I think about systems. So I am a medical sociologist by training. I feel like oftentimes I'm in a space where I say, I'm a medical sociologist, and people just look at me really weird. But ever since meeting Dr. Tate, I feel like this community here might look at me and know what that means. Like, oh, yes, we have anthropology in the room, and we have humanism in the room, and et cetera. So I'm really excited to be in this space, particularly talking to this group as a sociologist. And then my goal is really it's a big goal, but if I can just move the needle, I'll be really happy. But my goal is really to transform the face and practice of research, teaching, and care delivery. So the healthcare system is my domain. And partly because I grew up sick in the healthcare system. So that's my picture of me when I was younger at OHSU Dornbecker Hospital. So for me, it's really meaningful to be able to come back to this very institution that saved my life one too many times, and be part of how do we do better, right? I know we do great work, but there's always room for us to grow. So I start with this picture because pictures can say 1,000 words than I could. So for me, the first thing we have to do is really come to terms with how scientific progress has come and the humanity in which we sometimes forget about because we're trained to be objective, and neutral, and detached, whether you're a researcher or educator or clinician. It's very much embedded in our socialization to not care. But I want us to care, right? And I want us to name that where we're at today is not the best system. All of us enter the system thinking that we're going to change things, and sometimes we can, and sometimes we get caught up in the system itself. But I think it is important for us to name this, whether that's it with our colleagues as a researcher, or with our students as a teacher, or with our patients as providers, right? Like our progress is tied with really complicated and disturbing history. And I put history in red because sometimes I oftentimes think, and I don't think this will happen in this space, but as a sociologist, in non-sociological spaces, I have to hear the word, oh, but that was so long ago, right? That was a long time ago. And it really isn't. If you go down the street to an elderly home or one of those home care retirements, people lived this. It is not that far removed from us, and people are still alive, right? So it's not the world of yesterday. It still continues to be the fact sometimes in many spaces, which is unfortunate. So what I want to do now is involve everyone a little bit. I'm very interactive. So if everyone can just think of a memory, you can close your eyes or you can just keep them open, but just think of a memory, the last time that you felt seen or heard, whether in a healthcare setting or in a teaching setting or in a research setting, right? So bold enough to put it into the chat. I would love to hear some responses. But what about that experience made you feel seen, heard, or understood? I'm going to give a minute to think about this. I also do this activity because when I say a minute, it's actually a long time, right? You start to feel that. And sometimes even time is socially constructed. We don't have time to do this. We don't have time to do that. And I want to push us on that rhetoric too. So I'm seeing the chat. It says, included in the discussion, wanted to hear what I have to say. My new PCP remembered details about my work and life and asked how things were going. I love that. Yes. Ask questions, ask what questions I have. Last week, students stopped to discuss their projects after class. My new physical therapist felt like they were really taking time to address whole body. Ooh, I like that. Not rushing. Yep, exactly. Asked and invited to offer an opinion. Yes. Listened, heard, and responded when I had an issue. And I began working with a new physical therapist who's incredible. He listened to things I wanted to be able to accomplish after rehab. And I was feeling discouraged. And he asked me and said, when he sat me down, Tyler, you are going to be okay. You're going to run again, I promise. Oh, I love that. And I hope you run again soon. Yeah, acknowledging despite the differences. I love exactly, right? Like just saying it. Like we all know that sometimes there's a difference, but saying it really does acknowledge the reality. Recognize my fear, made a point to offer options. I love this. Thank you, Lori, Persona, Tyler, Lorena, Clifford, Luis, Sarah, Kristen, Jennifer, and Ruth for your responses. And keep them coming in as well. I appreciate this. So I found this image and it's kind of funny, but it's reality, right? It's this woman saying, I can't thank you enough, doctor. Like I really wanted to tell that to someone for so long. And it could be doctor, teacher, you can fill in a blank. And the doctor's like, oh, no. I lost my concentration and I missed everything she just said, right? Like I've had moments like that. You've had moments like that probably. And I don't blame Dr. Flag, right? I blame the system. He's probably worried about the next patient. He's probably worried about something else going on, right? It's so hard for us to be present and just mindfully with someone. And I see Jessica Tavares in the room here. So shout out to Jessica, because I've seen her brilliantly do this, right? Just really calm down and be with someone, right? Like that is an incredible gift that we can give to our patients, our students, our colleagues, our lab mates, etc. And sometimes it feels like it's nothing and it's everything. And so today I'm going to be proposing some tools and strategies that's going to help us really achieve equity in research, teaching, and clinical care. And for me, the key point is inaction, right? Not doing anything or feeling like this is too big for us to tackle is part of the problem, because it definitely reproduces a system where communities feel isolated, used, and unseen. Again, I'm going to say that communities feel isolated, used, and unseen. So this is the goal, right? Like we want to change that in our research process. We want to change that in our teaching environment. We want to change that in our clinical care, right? This is what it comes down to, humanizing each other. So 3 objectives today. Number 1 is to discuss the political determinants of inclusivity. So I would say that's my why. Why are we doing this? Like giving you a 3D framework is beautiful, but if you don't feel or move for the why, I think it's important for us to start there. And then we're going to engage with concrete strategies moving forward. So the what, the why, and the how. Okay, so why? As a sociologist, and I'm sure in the room with a lot of other folks in this space who would agree, but recognizing that there are political determinants of inclusivity, and I would push it forward saying belonging. So people and communities are underrepresented in silence by design, right? People and communities are underrepresented in silence by design. So therefore, it's a radical act for us to push back and create inclusive spaces. It feels uncomfortable. It doesn't feel like natural. And that's also a problem, right? How do we then normalize these strategies to push back? I love analogies, and I'm going to use the analogy of fishes throughout the entire talk today, and really making us just jump outside of our fishbowl, or what I would say, our comfort zone. We stay in that little bubble too. And the world is full of diversity, right? All kinds of diversities. And sometimes it can be overwhelming. And I don't mean diversity just racially. I mean sexually, I mean gender, I mean abilities, I mean hobbies, like all kinds of things, right? But there's so much pressure, and it's by design, because my brain will explode if I had to take on Tate, Dr. Tate as a new person, and Jessica as a new person, and Clifford as a new person, right? Like my mind will explode if I have to meet every single person and say, Estela, do not put them into boxes, get to know them as full, authentic human beings, right? Like it's impossible. Like our brain is designed to create shortcuts and to make assumptions and to make kind of, quick guesses, no matter if it's your teachers, clinicians, patients, etc. But the goal is to not do that, right? Like how do we recognize our biases? How do we recognize where our assumptions are going? And how do we push against that current to try to do things differently and be more inclusive. It's impossible for me to know what it feels like across all these different identities, right? I can understand what it feels like to be an immigrant. I can understand what it feels like. I don't know what it feels like to be a Black person, to be incarcerated, right? All the different identities. So I'm not asking, like, equity, I feel like sometimes gets thrown out there like, I can only be empathetic. I don't know what it's like to be XYZ. But there's so many ways that we can be very aware of the intersection of different identities and create better spaces. So to tell a story about why we need to transform, and for me, it comes down to stopping the reproduction of status quo, right? So it's a story about boxes and bubbles to really illustrate the need for us to stop this reproduction and for us to move beyond boxes and bubbles. So I'll never forget the day that the first time a teacher assigned me to a box, it was in middle school, right? And they said, not all of you are going to make it in this society. Statistics predict that some of you are not going to be successful, quote unquote. And that day, 8 of my friends and I left class and we went to the cafeteria, we sat down and our bodies were really tense. Is that true that we're not going to make it? Like already today, they know this. And we made a pact, like, nope. On April 1st, 2003, almost 20 years ago, we said, not us, we're going to beat the odds, right? Fast forward to 20 years later, Erica died from an overdose in her bathroom. Sarah was in and out of incarceration for robbery and theft. Julia became homeless. Susanna, who had the biggest smile, died by suicide. Samantha later pursued her nursing degree through a community college route. And I was the only one who went to a four-year college. And I know for a fact that I was not the smartest, nor the brightest of the group, so I should not have been the only one to have burst beyond these boxes and bubbles. But I am tired of living in a world where our light gets put out before we know what our passions are and our unique gifts to offer, right? And I am tired of all the boxes and bubbles and the statistics, right? How do we, after generation, continue to uphold the status quo and reproduce inequities? So for me, how do we move beyond the box is the same thing as saying, how do we move towards a system that is actually helping people and not failing people anymore, right? So for me, the need for us to burst beyond the boxes and bubbles, it's about questioning our social reality. What does that mean? Well, there's 3 terms that are needed to question our social reality. Dismantle, and I think definitions are important. Dismantle is defined by taking apart the machine or the structure so that it's in pieces, right? Do you actually understand your workplace culture well, or your teaching place culture, or your clinical care clinic? It requires critical reflection to take it apart piece by piece, right? Like, why do we do things the way we do? Where did this policy come from, right? How is it that we have this protocol in place? And then it's decolonizing, which means how do we get rid of the power dynamics or address the unequal power dynamics that reproduce these status quos? Because we all want to feel like we want to fit into a box, right? And I'm tired of trying to fit into a box. Don't fit into a box anymore, please. That literally reproduces the system, right? And this to me requires prioritizing relationships, right? Like engage with people. And then to deconstruct something in order to reconstruct it and put it into place. So I'm not here to tell us, let's just question everything and let's dismantle everything and decolonize everything just to like leave it apart, right? The goal is to like, okay, what are the new norms and practices and structures that we need to put into place to elevate and move towards this inclusion of a space that we want to be in. So let's break these down one by one. So dismantling, which is taking the machine apart, and it's critical reflection. Going back to my analogy of a fishbowl, right? So we're swimming and we're jumping out of our fishbowl right now, right? I know I mentioned the word socialization a few times, but just to be clear, in sociology, the way we define socialization is the process of internalizing the norms and ideologies of our society. And it's a powerful current, right? Sometimes we forget what we're socialized with. And there's a story that I love, like one fish tells another fish, hey, how is the water temperature? And the other fish says, what water, right? Like that shows how socialized we are sometimes, that we don't even know it. And there's 5 types: primary, secondary, anticipatory, professional, and resocialization. The one I want to emphasize today is the professional socialization, because we're all professionals, and this is a professional setting right now, right? What does it mean to be socialized into your profession, right? We are here to guard our profession. We're here to maintain the rigor of our profession. We're here to elevate our profession. But sometimes that distances us from our families, from our communities, from our patients, from our students, right? So how do we maintain professional rigor while also working with our communities and our students and our patients. So the way we learn our professional socialization is by going to meetings, right? Maybe education, master's degree, a PhD degree, whatever it is, right? Like this is all the way we're socialized into our profession. And one thing I think that oftentimes we forget is that within the professional world, it sometimes is assumed that the longer you're in a profession, the more power you have, right? 20, 30 years in the profession means you're very high status, lots of power. People are more likely to be deferential, not question, not push back. I actually think we should flip the script and think that new students, new professors, new researchers, new doctors actually have a lot of power. And we should recognize that because they haven't been socialized yet. They can see the water that we, and I would say me too, I've been in my profession for nearly 10 years now, right? Like I don't see sometimes anymore. Like I need the fresh perspective to keep me into check, right? And so it's important for that to happen because none of us can know what it's like to be a racial minority or sexual minority or LGBT minority or an immigrant minority, whatever it is, right? We need everybody to be able to see the different ways that the system is either oppressing us or uplifting us, right? And so one piece is, but I know that there's a powerful force for us not to do this, right? Like it's scary to think about what are our biases and assumptions. So the way you do this is critical reflection with some myths. What are some myths out there that you can push back and really think about? My research identity is my number one identity at OHC, right? I'm a researcher first, but I also do a lot of other things. So within the research enterprise, and I think you can fit this in teaching and clinical care too, right? There's this myth that anyone can do all kinds of research, or anyone can do great teaching, or anyone can be a great provider. But we know that the fact is that history, culture, lived experiences, grants, mentors, all that matter. The fact that we're in this room right now is a representation of a lot of different networks and relationships we had, right? It's not that, I mean, I would like to think Dr. T and others in this room is super smart and brilliant and got here because they're just super smart. There's so many smart people that are not making it to this level. There's so many hardworking people that are not making it to this level, right? And we know that representation matters. So this is a image right here of a mountain, and you can go to this citation, but I like this image because it really talks about racism specifically and Black scientists and how they're literally just falling off the ladder as they go, and we don't have them. Not because they don't work hard, right? But because the research enterprise is not research being objective, right? It's people conduct research. People bring themselves into research. Most researchers do not look like from the community they come from, and there's a significant unequal distribution of access, resources, and support, period, right? And so we need to push back against this myth that if you just work hard or anyone can do this kind of research, because that's not true. Myth number two is if you get the science right, then the research tells you the truth. And truth, I'm sure, is something you guys have discussed in this space because it's very socially constructed, capital T truth, lowercase t truth. Every decision point before, during, and after introduces bias. There's actually 150 biases out. And I like this quote a lot because it reinforces us to think of our world. So scientists or researchers, or you can even put in teachers here or doctors, right? We like to see ourselves as objectively exploring the world above the political fray. But such views of scientific neutrality are naive, as study findings inevitably are influenced by the biases of the people conducting the work and the structures in which the work is being produced in. Very true, right? And there's another image of the fishbowl about flatness this time. And then the third myth is that it's an us versus them, that we, the researchers, or we, the teachers, or we, the doctors, have the solution, right? And the truth is it's a we, like it's a we in this society. When I say I'm a CBPR scholar, oftentimes the reaction I get from people is like, oh, but I'm a clinical or heart scientist. Or, oh, but I'm a teacher and I teach 500 students at one point. I cannot engage them, right? I think we need to push back against that mentality. CBPR is a model that's, I think, a little complicated and way out there. I'm not saying we need to adhere to all these principles to be engaged with our community. I do know there's a lot of ways we can engage our community without going through all these different models, right? Even if you're a bench scientist or whatever way, there's so many creative ways to do it. But reach out, and I'm always happy to brainstorm for different pieces. So the first part is just taking it apart. I don't know what world you're in or what space you occupy in, but the first part is just taking apart your world, being very critical about your world, right? And the way I would redefine research as an example, right? And you can do this in your own world, but research sometimes is defined as the systematic investigation into the study of materials and resources in order to establish facts and reach new conclusions, right? For me and for others in this social enterprise, the research enterprise interacts with manufacturing, commercial, legal, political, economic, and other systems, right? Already before I get to know what grants I applied for, what grants are out there, who funds the research, and how much are they funding, and what's the hot topic right now, right? Like there's all these different ways our systems is actually structured and set up in very fascinating ways before we do anything we do, right? And so I want you to question that world you're in. What are the different systems interacting in your world, right? What are the different plays there? For doctors, it's the insurance status, right? Insurance companies. But many doctors don't take time to really dive into the insurance companies and get to know their protocols and policies and how does it work, right? That would be a piece of it. But I'm not asking you to be an expert with insurances, but I'm asking you to find someone who's an expert in insurances and make them your friend, right? I'm asking you to make those networks to find and understand your system and environment better. That's what I'm saying. So part two is decolonizing, and the main piece here is prioritizing relationships, right? And it's the scary word of the power.
Basically, the kid got to me in point.
So before I go on a little bit more into this one, what is equity? And I want to make sure we have a collective vision here, because sometimes equity for some people means I have to lose something for someone else to gain, and that is not equity, right? I like this image here on the left or your right, with the ladder. I don't like the tree. I don't like the baseball. I don't like the bicycles. This image of the ladder for me is better because it's about, again, structures and systems, right? That there's literally rungs missing. I don't care what their dream is. I don't care where they're going. That's not for me to decide. But the fact that there are ladders missing, and structurally, no matter how hard this little green person is reaching, it's impossible, right? It goes back to that hard work ethic kind of myth. And how do we as a society, one, identify these ladders, and two, mobilize resources and communities to ensure that people actually have ladders under. Part of it is, here's a few things, but like it comes back to just networking, being in communication with people, telling your stories to others. Not everyone knows where you come from, right? But equity is not about losing. Equity is about realizing that the structures and environments is literally. And for me, I think the worst service we've done in this world, and it makes me so sad, so many students, so many patients, and so many lab mates internalize their failures, right? They think it's me. And I want to move us towards a world that is not about internalization, right? Because that's the whole point of power and the panopticism, which I'll get to in a minute. So how do we do this is something called, I call it the power networking analysis. I'm happy to share more resources afterwards. I've done it with my team in all the different spaces I've worked in, and I actually learned this analysis in the policy world. They do this all the time. They map out their power relationships, they map out who they're working with, what relationships they have. You can do this as an individual or as an organization, right? And the point is to really think about where your power, where your relationships at, with who, what's missing, what relationship do you have, and really assess those networks, right? And it's all about mobilizing, and in the policy world, it's about mobilizing to create some sort of win with some sort of policy, right? But I found this tool to be super helpful because it really does name things, right? You can't address things until you name things. And until you say, oh, there is an imbalance of power here, or an imbalance of resources here, an imbalance of like, we're not talking to you, or we're not inviting you at the table, right? Like, but you have to map it out to see those areas of opportunities or areas of challenges, right? And so it's a very cool tool that is amazing. So part of decolonization is, I don't want you to leave this talk thinking that it's just you that have to change, right? It's two sides of the same coin. It's the researcher, the teacher, the clinician, but it's also the institution of the structures in which have to change too. And it's, I don't know if it's the chicken or the egg, or if it's both. I think it's both at the same time, right? And we're trying to do the best we can. But as the person doing the work, we just need to recognize that we are socialized to be disconnected from our practice. And we are socialized to kind of have unclear responsibility. Like, what is that social contract you sign? And we say social contract in sociology a lot because each of our professions have, figuratively, not literally, but we've signed a social contract where we told society, give us all these resources and power and prestige because we will ensure that you will be healthy and well. Give us all this power, research, and prestige as a research academic institution because we will ensure that we do research that betters the society, right? Etc. Like, but it's very unclear. Are we responsible to our profession, or are we ultimately responsible to the community and the patients and the students that we serve, right? It's not always clear. And we're confused. We're not neutral. I don't believe that there's a neutral stance in the world, in the work we do. I just don't think it can exist. And there is, I have a big problem with the word discovery, right? We as old, is what is it, new wine in old bottles, or wine in old bottles, like we're constantly reinventing the wheel, right? As in academia, I know we get prestige, naming some new concept, by naming some new framework. It's the same thing, just in different bottles or wines or structures, right? It's the inequities are growing. The inequities are well documented. I don't need another study telling me that or discovering me different pieces, but I do need us to understand the mechanism and the process and how we contribute. And then in the enterprise, we just need to see more community, more ownership, collective, land-based kind of stuff, structurally, justice, cross-cultural. There's so many things we can do in the systems level as well that could be institutionalized, right? So to end this section is every day we are either perpetuating the system or we're transforming and stopping this cycle of this harmful system every day, right? Because inaction is action. And part of decolonizing, if you get anything from my talk, is undoing the fitting in. I don't need you to fit in anymore. Please stop trying to fit into a system that isn't working, right? But it's socializing us to want to be accepted by our peers, to want to be accepted and feel like we belong, to want to feel that we don't want to ruffle feathers, right? But we have a voice and agency and power, and even though we're made to feel small. I love this panopticism here, going back to Foucault for those who love power and theory, right? It doesn't matter if there's if there's guards in the middle of that space, all the prisoners are going to fall in place in line and act as if there is, right? And as a society, we regulate each other. We do, right? When's the last time you talked to a colleague and had a hard conversation about something that you didn't like, or something that you saw, right? We can make a difference, and we need to make a difference. And I think we are making a difference, but we need to share. That's the other thing. When you do something, share that you're doing something, because sometimes it feels like change is happening, but over there, I don't know where this change is happening, right? It's not in my sphere, but just share it because it is happening. Finally, how do we rebuild this, right? Like, what new policy structures and norms am I talking about? Well, ultimately, it's up to each of us to interpret that bubble, right? We're reducing something, we're taking it apart to rebuild it, but we're building it together. I don't think any of us would want a society where one person just dominates and tells us what this new structure is, right? We need all these voices and perspectives telling us what this is. But what I will say is, even though I took you outside of your bubble and took you to the ocean, which is very overwhelming, I need you to find the middle spot, right? I'm not asking you to be big P policy, go to the Capitol and testify. And please do. We have power and we can. But I'm also not asking you to stay in your individual little bubble anymore. Right? I'm asking you to move towards this organizational bubble. OHSU is a massive institution. PSU is a massive institution, right? All these institutions are pretty big, but find that middle ground for you and start to deconstruct in order to reconstruct your research environment, teaching environment, clinical care environment, right? I know there's already, because of what I do and what I say and the spaces I go work in, like every day, I'm always amazed at these different radical ways of doing things. And I learned so many things of how we can do things differently, right? But I am tired of trying to change our attitudes and knowledge and even skills. I don't need attitudes and knowledge change. I need behavior change, right? That's what we need as a society. We need action. We need people to do things now, right? It's no longer nice to think about equity. We need to do something to mobilize it. So yes, right, we need to recognize the sexist, racism policies that have been in existence. Yes, there's some balance between choice and constraints. I'm not saying you can go and do things. But one area of opportunity is really capitalizing on pathways. I don't use pipeline programs, Native American connotation to it. I use pathways. But it's not about having a seat at the table anymore, right? It's about having a voice, and a voice that is heard. That's why I started with that reflective piece. And heard and seen. Because just having a seat at the table is no longer enough. There's more and more papers coming out about this, right? And also, one concrete thing you can do is there's this literature that's building, and it's called bias interrupters. And it's this evidence-based model for really tackling systemic level bias. What kind of either racism, sexism, homophobia, you name it, right? Classism. The model comes from this idea, like in psychology, there's this famous study. I'm sure you guys have heard of it, but it's like you wake up in the middle of the night because there's a house that's burning down in your neighborhood. And you're like, oh my gosh, the house is burning down, right? So you go to the window and you're like, wow, the house is burning down, but I see all my neighbors outside looking at the house burning down already. Like many lights are on. And you think to yourself, why call 911, right? My neighbor already did it. The house is literally burning down. Someone already did it, right? And everyone's thinking that someone already is calling 911. And the thing is, no one called 911 because everybody's thinking that everybody else already called 911. And so that's the whole idea behind this bias interrupters, right? Is that you can't, in this equity world where now all of a sudden we're all doing equity work and we're all interested in equity, we're like, oh yeah, we're all doing it. Yeah, we're all doing it. But if you don't name someone or task someone or a group, and this is a little difficult, and I would say rotating the role. You don't also want to name someone who's burdened by these systemic struggles to address the struggles, but you do need to name someone to just point it out, name it, be a bias interrupter, right? Like that's the term that is being used, and this comes from the policy world. And so that's something really concrete, right? Because just like I need to say, Dr. Tate, call 911, right? Like you go call 911. You need to name it and literally have that. The other thing is about making equity an agenda item. Everybody here, I'm sure you guys have a lot of meetings. I have a lot of meetings too. Is equity an agenda item for you? I always pause here because people are like, oh, that's interesting. What do you get when you put equity as an agenda? You get a lot. I mean, I can't, by design, I can't run away from equity. It is who I am and where I come from in my family, right? But the fact that there's people who can just not think about it or not address it, like it's everywhere. So when you make it an equity agenda item, from a research perspective, like say someone talked to a participant and that participant told them, thank you so much for giving me $50 to be part of this study. But just to let you know, I used $10 of that just to get a Lyft or Uber to get here. So only left me with $40, right? Then you go back to your team and be like, hey, I need to mention this. We need to change this. So my point is just make it an agenda item and you'll see how it changes the conversation and what actually comes forward. Maybe you're reading a book and you want to share it. Many things can come out of it. And for me, it's the design process, right? How do we democratize the design process? We're all designing either research or we're designing curriculum or we're designing our care plan. Or like I started again, when was the last time you felt seen, heard, or understood, right? It's when you were involved, when you were given a chance to be involved, right? So democratize that design process no matter what space you're in. And we're all mentoring, right? All continuously, we're mentoring up, we're mentoring down, we're mentoring sideways. We're always either think of the next generation behind you, but also think of the generation in front of you. And the design piece is key for me here, right? The design piece is very important. And you could put anti-racism, anti-sexism, whatever, right? Like, and I mentioned earlier, there's 150 different types of biases. I actually quiz my students, like, okay, let's talk about new bias today. What bias are we talking about this week, right? Like, there's a ton of different biases, right? And just every single decision-making point has to. It's very hard for us to have an intersectional lens when we haven't lived the lived experiences of all these types of different identities. So you need feedback. And I'm learning, even me, right? We're all learning. We're all learning and unlearning continuously, right? Asking for feedback earlier and earlier and earlier is so critical, right? Having community discussions. When I say community, I don't just mean community in terms of patients or students, but even your colleagues, right? This space is a community. So I'm so happy you guys have these talks and can engage in these different things. So finally, to move forward to the last part of the talk, some tools to leave you moving forward. I know I wear a lot of different hats. Well, I know kind of I'm consolidating my hats. My main hats is the researcher now, but be honest, make it actionable, make it transparent, and be very specific, right? Like one specific, actionable, honest thing I can share with you all is like when I have a CBPR team with the University of New Mexico. We finished this project, we published it, but we didn't just stop there, right? We made sure to do an en vivo podcast because we changed the way we did qualitative analysis with communities, and we did it in Spanish with en vivo. We're like, yes, we're going to do this, but we want it in Spanish because this is our primary language, and we want to change the narrative. When we go to conferences, we invite my community partners, and we give it in Spanish, right? We flip it. So do different things, be creative. I think when we're born, we're so creative. We always ask, why this, why that? And we're so creative. We think out of the box. My favorite videos of American Funniest videos are just kids who take things literally, right? Keep your eye on the ball, and they literally put their eye on the ball. But we lose this growing up, right? We grow up and then we question everything, and we're like, don't take it literal anymore. And I want us to be creative and innovative, right? Doing the same thing over and over isn't going to change the systems we're reproducing. And it's a lifelong journey, right? No more Band-Aids. Please stop trying to fit into the system. I know so many students, I know so many patients. I've heard their stories. They're bleeding, right? They're hurt. It's unfortunate when we try to act like, I'm okay. It's fine. It's not fine, right? It's not okay. And the more we can show where we're bleeding, or the more we can show these painful scars, the more the system will respond, right? The more the system will say, that's not okay. What are we doing to stop this, right? What are we doing to change this? So patience, we're not gonna solve this today. We've been socialized, including me, for 30 years or plus, right? We can't get it right in one day or one training. A system is not just culture change, it's structural changes, and it takes time. And I would say, let's move more towards process-oriented versus outcome is great, and I want my future kids to benefit from a better system. But if we can really focus on the process and how we do things, humanizing each other, humanizing the process, in a culture that commodifies people, in a culture that literally makes money and business off of all of these enterprise, research, teaching, care delivery. So sometimes how do we push back as a society, in a network, in community, right? And finally, I love puzzles. During the COVID era, I was obsessed with puzzles. I probably gave one to every single one of my family members. I think puzzles are really representative of our society. And I have yet to make a puzzle and not lose a piece, but that is my goal. Somehow I'm always missing a piece, but this one, I actually managed to do it without missing a piece. But when a piece is missing, obvious, right? Like, oh, that piece right there is missing. And why I use a puzzle is because it's so important for every single person in this group, in this virtual space today, to do their part, right? Because you can't get a complete transformation. You can't get the complete picture if you're missing a piece, right? We are all needed, right? I think it's dangerous when we live in a society and feel like, oh, I'm not needed. My voice is not important, or I don't bring something special, right? Like, I do believe that we all bring something unique of a talent. We all bring very unique intersectional lives. We all bring very unique intersectional trainings, right? But sometimes we isolate ourselves because I am my professional role right now, which means I don't talk about these other identities. And COVID has done something beautiful, I think. It's been harmful, it's been horrible, but it finally has allowed us to kind of deconstruct this false binary between personal and professional, right? Like seeing your kids in the background, being able to multitask. I mean, we're complicated human beings, and siloing or kind of fragmenting us is not doing justice. And we have a system of siloing and fragmenting. That is actually how the system continues to reproduce itself, because we stay in our bubble, right? We continue to fragment and silo. The historian people are over there, the sociologist people are over there, the political science people over there, anthropologists over here, medicine is over here, police is over here, firemen is over here. And then we realize that when we work together, we have intersectional kind of designs and programs. That's when we succeed. And I'll mention the tax story just because I know Dr. Tate mentioned, and some of you guys might be thinking about, what about taxes? So taxes is one of the largest structures of our society. It literally structures so much, right? How we claim our taxes, who do our taxes, And one of the innovative things that clinicians are now doing in healthcare settings is they're actually introducing a tax person, consultant, helping their patients. And there's already research documenting how, one, radical that is, but two, how significant of a transformation and how it increases health and well-being of their patients significantly, right? It allows them to put money back into resources, claim the earned income tax credit, claim the working families tax credit, claim whatever other tax credits they can. We know that putting money back into the pockets of our families kind of help them and allow them to not just survive, but thrive, right? And then the taxes too is like, who gets to dictate what classes happen? The Swiss cheese analyses, I literally saw in action when I was in DC and at the state capitol working. Those who have money to be able to lobby and be able to make carve-outs is literally destroying our system, right? Our tax-based policy. So I spent a year trying to understand this massive infrastructure of taxes. And I hope you guys think of the creative ways now. What other partners or relationships can we make in our clinical spaces or in our teaching spaces or in our research spaces that we can do radical transformation, actually address and achieve equity in ways that we're thinking of doing it. So I'm going to leave it there. Muchas gracias for your time. And I please ask you to give me feedback with this QR code or this link. You'll have access to my slides. Thank you so much, Dr. Tate, for having me. And we can open it for concerns, questions, needs, insights, comments. Gracias.
Gracias. Thank you for that wonderful talk. I bring a lot of thoughts. I wrote down 5 different things. I'll start with a question while others are gathering their own questions. You can stop sharing your screen if you would like.
Yes,
and then
that is a
people can
great
turn on
idea.
their cameras. People can turn on their cameras if they would like. And lots of hand clapping, which I would echo. And then feel free to use your hand raise icon if you have a question. I'll start, and I was trying to think of which one do I want to ask. I was hoping, Shirley, could you just say a bit more about the old wine and new wine bottles kind of metaphor, and what is maybe just one concrete example where you've seen that happening frequently that we could sort of address? And if you think about that more in like the research space, like all the papers that are just say the same dang thing, and then people are getting credit for and making their careers off of these kind of things, or how you see that operating.
Yeah, well, that's exactly it. I'll find the paper. There was a paper that I read that it's actually titled that. It's like, I think it's called New Old Wine in New Bottles, or I forget the exact phrasing of it. But the point is that we continue to repackage things in different ways. And one of the concrete examples I can give is just social determinants of health, right? Like that thing became so popularized in this space. But when we think about it in sociology, it's like we've been thinking about that for hundreds of years now, right? Like that is, or we say social factors, or we say, the structural determinants, or we say like all these different phrases of it, but ultimately it comes down to where we work, live, play. And now there's this new concept that's even more important, but the structural determinants, which are the factors that affect the social determinants that affect the health. Like, I think it's just like all these different ways of thinking about it, but we know that our environment matters. And we've known that our environment matters, right? That's a good question.
It's kind of like get on with it and like get to do work rather than just continuing to study the thing, in a sense.
Yeah,
Dr. Guadino, feel free to unmute yourself. Oh, I see your hand raised. Jim, do you want to ask a question?
maybe audio.
Maybe having some audio questions. If you're having trouble with audio, Jim, you feel free to write your question into the box, and I'll ask it. And Lois, if you I give some really rich comments, and you're welcome to unmute
I'm
them
trying
and
to catch
mention
up.
them.
Yeah, I mean, this is fantastic. I'll capture my comments and then pose the question. One comment is just pipeline versus pathway. I don't know why I never thought about that, but just for everybody here, pipelines run through lands, they destroy native culture, they destroy native rights, they destroy the environment, which ultimately harms all of us. So I guess even in a selfish way, you should care, even if you don't care about equity, but you should care about equity, and I'll presume you do. but also not just that I will no longer say pipeline, but you remind me that even though I think I'm being super careful with my language, all of us all the time need to be thinking about the assumptions and inequities that we perpetuate in language. And I also put in the chat a link. I just finished a project for Metropolitan Family Service, known as MFS Cache Oregon. They do free tax preparation and filing for anyone in Oregon as long as they qualify based on income. There is $150 million in unclaimed tax credits for poor Oregonians, mostly earned income tax credits at the federal and state level. You can refer people to Cache Oregon year round. They can backfile for past years. It's an incredible resource and they would love to have you, and I will connect you afterwards. So here's my question. You talked about the need for perspectives and bringing many perspectives in. And that's a great example of like, you know, hey, I know about this Cache Oregon and you know about patients. It never even occurred to me or them to connect through the healthcare system. But in your list of everybody who needs to come to the table, you included, for example, the police. And we know that for some communities, even being at the table, I will say, is actually a cultural norm. I liked voices in the conversation as opposed to spaces at the table. But how do we create the spaces in which we have the right conversations happening, all the perspectives in, with the understanding that real harm has been and continues to be done by some of the people whose perspectives have to at least be taken into consideration? Like, that seems to me the biggest, stickiest piece of all of this. And you seem so very, very insightful that I just wanted to kind of ask you for that. Thank you.
That's an excellent question. I think that's why I started my talk with that picture of the disturbing reality of where scientific progress comes from. I think in whatever space you're occupying in, it just has to be the first thing. Like, I've noticed a huge change when I do it in different spaces, just acknowledging, again, you may not have been part of the problem, right? You may not have been part of that era or instance, but knowing that you know that that has happened, making a statement, acknowledging it, I think is so critical. And then the other piece is this, it's like a paradox, right? Sometimes we are part of the profession and sometimes we're individuals. And I think in those spaces, you know, it's our titles that come forward more. And you mentioned police specifically, right? But it's just like the same thing with doctors or firemen or anything. Like, why did you decide to do the profession you do, right? Oh, so many times because people want to help people. And the system is designed to not help them actually help people. And yeah, there's probably rotten apples out there and not everybody's right. Like, I get that. But for me, it's like, how do you create a space? And it depends. I don't know. I would love to have a follow-up with you too. Like, it depends what the goal of that space is too, right? Like, what's the working objective? What's the agenda? But making time, you know, I used to be part of the relational lab here at OHSU, and it's just making time to get to know each other, because it's so easy to jump to conclusion or assumption about each other, and just creating space for that, I feel like has been really helpful. And sometimes not having them at the table. Like, if you know it's going to be a problem, don't invite them, please. Like, it creates even more ruffles. And think of it as not just a one opportunity, but it's a series of conversations, right? So who's there at the first point? Who's there at the second point? Who's there at the third point, right? It's all about the process, and you can't just do it in a one instance. Yeah, I think that's a great question. And thank you so much for sharing that. And I will mention, when I was working in New Mexico for the New Mexico, the earned income tax credit and the working income tax are two, a lot of unclaimed taxes. One piece of the puzzle we're still working on is how do we get undocumented immigrants to also be eligible? Because unfortunately, a lot of states don't allow that yet. And so there's so much potential there too, right? And that's another piece of the puzzle. But thank you for all you do. And thank you for your comment, Louis.
Thank you. Dr. Guadagnino, have you figured your audio out? I see you wrote. We can just have people can refer to it. Oh, there we go.
Thanks. Great. I don't know what happened. Well, thank you so much, Dr. Guzman. Really, what we're talking about, I think core to what you were saying is power. And the system that we have right now gives a lot of power to researchers, gives a lot of power to politicians, etc. And I have colleagues, I have younger colleagues. I've been an epidemiologist and in public health for 35 years. And we're just starting to get the idea that we really need communities. And in particular, at what point, and there's a project that I started here in Portland, which we actually started through facilitation through that public health department, but we actually gave power over to the groups that were working. So they actually, it was their project, and we were facilitating. And I really had to argue with my bosses that no, we don't own this. We really need the community. If we want to really understand what's going on and make a difference, we really need a community-driven program. But at what point I was in another forum at PSU about immigrants' experience with COVID. And the discussion, they were talking about all the things that they did with funding, et cetera. And I was noticing, or I pointed out that the state public health department was very slow at getting data to those groups. And at one point, somebody said, you know, that's a really good point, because we really needed the data to see if we could actually we were making a difference in our work. Another point resonated with me because I heard this at the beginning of my career during the beginning of the AIDS epidemic is, look, we don't need the data. We know what to do. And that was way before AZT or any antivirals. So at what point do we strike a balance, and how do we negotiate that? Appreciate your help and your talk, and thank you so much.
All excellent comments. Thank you so much for that. You made me realize, you made me remember a moment that I had in my career. I'm still very early in my career and starting, but I remember there was someone in a position of power, and it really struck me. So I think part of this is just a changing culture as well. But I mentioned that I was a CBPR scholar, and exactly what you said, right? We give the power to the community, it's community driven. And they were like, well, then why did you get a PhD if you're the expert? And I was flabbergasted, right? I'm like, wow, that's an interesting mentality to think that you think that I have to have why get a PhD? Because now you have power and you get to decide and dictate what's going to happen, right? And I was like, that is the exact opposite of why maybe I should have given him a one-on-one article of CBPR. But like, I think there's a hesitancy still for that reason. And like I mentioned earlier, like, our professional allegiance is to what, right? Like, is it to our profession? Is it to the actual patients we serve, the communities we serve, the patient we serve, right? And you know, I mean, you got to play the dance, because we got to be part of the system to survive it. And then we also want to be transforming the system so that we can leave it better and differently. But your point is exactly on the spot. And funders, however, are starting to realize, and it comes down to trust, is what I think. Because a lot of funders micromanage how they spend the money, where the money goes. You submit a proposal, you have to tell them exactly what's going to happen. But when you do community work, it's negotiated. You do it together, and you don't know exactly what's going to happen, right? And so there is a movement. I mean, we just finished an RWGF project right now that was very generous and very opposite and very open to us. Like, you know, the community has driven this, like, be as open and generative and iterative process as possible. And I think more funders are starting to do that, but it comes down to trust, right? Like, this micromanaging or wanting data to document things or wanting evidence to show that my XYZ was worth it. And unfortunately, in this time period of 3 months or 6 months or 2 years, when we know change in time, just it might be 5 years from now that you get to see differences or change. So that temporality is an issue of this as well. I don't think I have the magic answer for you, but I do think by having these conversations with our funders is a start, and by really naming these things with our communities is a start too. Because sometimes the community looks at us and be like, "Oh, but you guys are all the same," or "You guys do the," and we have to break it down, right? Like, I just had a session with the community where I said, you know, residents have coats up to here and doctors have coats down to here, like, you know, and that people don't even know, and we forget what our communities don't know, right? And having them hints and insights into how the system works, I think actually makes them a stronger partner to help us advocate to transform the system.
Thanks for your awesome and in-depth responses. I wish we had more time. Dr. Kelly, I saw you had your hand up. So depending on how, I'm going to kind of close us off. And then if folks want to stay on, I'm happy to stay on for a few more minutes. We could ask one last question. But before we do that, I just want to briefly announce one thing. So this is our final OBHC of this season, and I'm super excited to announce that starting in the fall, we will have actually a formal launch of OBHC that will include CE, continuing education credits, and with more in-person visits. And so we're going to actually kick off OBHC for the fall with, I'm super excited to say, with a visit for in-person visit with Dr. Lainey Ross, who's a personal hero of mine in bioethics. Dr. Ross is longtime professor, pediatrician, philosopher, bioethicist at the University of Chicago, who's now the inaugural chair of bioethics at the University of Rochester, and the director of the Paul M. Shire, MD, Center for Bioethics. She'll be joining us for pediatric grand rounds in person on Thursday, October 5th, and we'll be spending 2 days ahead of that with us in a variety of meetings. So please put that down on your calendar. But now, just with everyone, just join me giving a round of applause for our speaker today, Dr. Estela Guzman, who I just am so grateful for your fantastic talk. And if folks can stay around for one last question, Maureen, if you want to ask it, I'm in for it. I got 10 more minutes, so.
Yeah, thank you so
if you
much,
can stay,
Dr.
that'd be great.
Vasquez. It was really an amazing, inspiring talk, and I was furiously writing down all the great references you included in your own thinking is really wonderful and powerful. So thank you for that. Something I wrestle with and wonder if you could say more about is a tension between those two really powerful ideas you introduced. One was the damage of fitting in, the damage of sort of being put in a box or expected to fit within a box. And then on the other hand, the goal of belonging, or even not goal, but just the need. We have this human need for belonging, right? It's a very emotional, visceral need. And those two sometimes to me are in tension. And I wonder if you could say more about how practically we could reconcile that sense of like, where do you find your safe space and belonging, which oftentimes for people I know as a woman, it's when I'm in a group with other women and we can openly talk about some of the challenges we face and how we've been marginalized in academic medicine. And, we don't sort of have someone judging us as we're talking and sharing stories and laughing and having a sense of dark humor about it. But then that's not fitting into the larger group as a group of women who've been marginalized. So that's just an example. And I wonder if you could talk through what that puzzle looks like, because the puzzle metaphor was beautiful. But in reality and teaching and our assessment of promotion, tenure, and all these other activities where we have this tension of belonging versus not being cookie cutter and forcing people to fit in. I wonder if you could say more about how you reconcile those in your own work, in your own mind.
That is an excellent point and a very real paradox. You nicely explained it. I feel like I feel the same with what you just said. I can resonate in many ways. I think for me, there's this concept, I think you've heard it often, like what does it mean to belong to is what I would say. Like sometimes I think, especially now with like, oh, you should be your full authentic self, right? There's this rhetoric of like being your full authentic self in the workplace. And I read the two opposing kind of perspectives because some people love it and some people don't really like it. I think there's a fine line. Here's my response to those kind of comments and perspective is like, when we say be your full authentic self, sometimes I think people equate that with like bring all of your problems, bring all of your messiness, and bring all of that into this workspace. And I think for some people that reaction of like, whoa, that's too much. Like I don't want to know all that personal stuff, or I don't want to engage with my colleagues in that personal level. But where I draw the line is like, if you can't even be, it's not just so much about bring all of your baggage, but bring who you are at your core. And the fact that we live in a system that's for white, male, hetero, cis, normative, like, et cetera, like the fact that I can't show up and try not to be that is what we're talking about, right? Like, I'm not talking about bring your full authentic self in the sense of like all of your baggage and all your concerns and all your worries, but I am saying that you should be able to be in a space and not try to, what some people say, code switch, or what I would say is body switch, because it's an emotional process. It's not just and you know, for me, it's not so much about creating a safe space, but a brave space where we can have these very challenging conversations. And trust me, like, I'm still working on conflict avoidance kind of tendencies, right? Like, it's easy to like not want to name things or say things. And I think it's hard to be your full self or to be in a place of belonging, or if you feel like you're changing yourself. And I think those are the territory where I start to try to draw the line. And if that's happening, then, you know, a shift has to occur. Now, there are spaces where, you know, like say you and I are in a space with other Latina women, feel so organic and so easy, right? And I say that on purpose because that's literally what the white world feels. And sometimes it just takes it for granted that people can just show up, and people are talking about hiking or like the food they had. But if you didn't grow up that way, you're like, oh, that's interesting. Never heard of that mountain, or, you know, never heard of that food. And so it's like, it's so interesting how like even those informal spaces where people think like it shouldn't matter, they matter even more, because that's where we see the differences happen, right? And so it's not in just this formal structural way, but I think it's also in the informal way. And I don't know if I'm, again, like the magic answer for you, but I do think that like, I don't want us to be put in a box, or to feel like I have to be Latina person on this panel. That's also part of that perspective, right? Because like, even my own lived experience can't capture the complexity of immigrant experience. I am one perspective of that. There's so much nuance to that. And I think maybe that's why I'm such a believer of qualitative work, right? Like, the more nuance we can get, the more tailored we can get. And it's not this like moving away from representation and more about what's your truth, and let's invite as many different truths as possible to the table, right? And how do we acknowledge all these different truths that are at times opposing, but do coexist? Is it a 6 or a 9? It's both, depending on where you're at with the 6 or 9, right? Yeah, you bring an excellent point, Maureen. I don't know if I have the full answer for you, but I do think that we should be able to show up and not feel like we're questioning our abilities. And oh, there's a great article. I should look it up and send it to you. There's a person who was saying like, let's stop calling it imposter syndrome, because it's not. The system was designed to make us feel that way. And they have this other term, again, talking about the terms, that's their take. But it was so brilliant, because it was like, the system is designed to do this. So why are we all of a sudden so like, oh my God, like we all feel like an imposter syndrome? When it's like, no, like that is literally the natural response to a system that's already told you what's normal and what's accepted and what's successful. Even leadership styles, right? We can have a whole conversation about leadership styles too. What's the accepted leadership style? What are the different leadership styles? We still continue to prioritize authoritarian doers in this society when we know that more relational leaders are just as effective, or humanitarian leaders. Yeah, so I feel like I'm just rambling on now, but it's a tension, and I think we're doing the best we can. I don't want you to be walking on eggshells, and it's dangerous when we feel like we can't talk about our own experiences without feeling like, oh, that's weird. So, good question.
Thank you. Thank you for those reflections. Really helpful.
Yeah, that's awesome. Plus, do you have anyone can just jump off now if they need to go, but I'm happy to keep this space open for a minute more. I don't